So I'm sad to tell you that this bus picture was taken in Sweden just 2 days ago. And we can clearly see there is no social distancing. In fact, there's social crowding. So that's actually a pretty frightening picture, really. Now, the reason I show this is I've just been listening to a fascinating talk by 2 American doctors on the New English Journal of Medicine site, and I'll put the link. You can listen to their podcast. Now, they weren't saying that the virus is not spread on surfaces. They are agreeing the virus is spread on surfaces. The virus is spread by fomites, mobile phones or pens or whatever. The virus is spread on surfaces. It does go from surfaces to people's mouths. But in practice, they believe that most people have actually been infected through droplet infection, through not keeping their 2 meters distance. That determines our existence. Through not realising our health depends on everyone else. So they were saying the main driver of infection is actually droplet infection, showing the absolutely crucial nature of maintaining 2 meters distance from absolutely everyone who is not in your household at the time being. So yes, we carry on with meticulous hygiene, of course. We clean our surfaces, we disinfect with alcohol, we do all that. We're not saying that doesn't happen. We know for a fact it does. But they were believing that the main driver of infection, that most cases were caused by droplet infection. So I'll let you listen to that at your leisure, and I'll post the direct link. Well worth a listen. Now, Saturday the 28th of March, total number of infected cases confirmed in the world, total number of deaths in the world, total number of recovered in the world. So things still going up in terms of numbers. Now, I'm going to flag up South Korea first, because the number of cases in South Korea is rising slowly. Because they've got extensive testing and contact tracing. Now, this is really epidemiology at its most basic: testing, contact tracing, isolation and quarantine, and yet it's not being done all around the world. Am I missing something here? And I'll give you some examples of where it's not being done as we go through. Now, Germany, the cases are increasing, but the Germans are testing an awful lot, so that's very encouraging to see. Lots of testing going on in Germany. Now, places where the news is appalling, or where the news is not so good. Another 8,000 cases in the last 24 hours in Spain, taking it up to that total number of infirmed cases. Another 832 deaths, bringing it up to 5,700 deaths, the worst in 24 hours. Now, these figures, of course, are truly tragic and appalling. But I expect them to go down as the effects of the Spanish lockdown increases. And the benefit of the Spanish lockdown works through the incubation period of the disease, which is typically a week, but can be up to 14 days. 2 to 14 days. So I'm expecting this to increase, maybe in the short term, but I'm hoping Spain is going to peak really soon, hopefully about 10 days after the lockdown was instigated. So there are going to be bad days ahead, but there is hope, because this lockdown will start to work. And especially if Spain brings on more tests and they do extensive testing and contact tracing as well. We need this double approach. Now, this ice rink in Madrid that seems to have been bothering me for days, apparently it's now full of dead bodies. Apparently, full lockdown in Spain, of course, as in the UK now. Now, I heard a report from Spain that people were driving around a bit last weekend. Going out for a nice trip or whatever, going to the sea. That's much less this weekend. This is no time for any non-essential trips out of the home. It's that simple. If your trip is non-essential, do not make that trip. Public concern is increasing in Spain, so public compliance is probably also increasing as well as a result of that. So that's encouraging. Now, my country, the UK, a few interesting things here. We know this is a massive underestimate. It's 10 or 20 times that. The testing here is lamentable. Doubling time is every 3 to 4 days. But again, we expect this to start reducing now, because the lockdown effect will start to work. So it will go on increasing for a few days. Deaths will go on increasing for a few days. But then the lockdown measures will start to work. And we will, I firmly believe, see a reduction in this next week. I'm afraid that's true. Temporary morgue set up. Elective surgery suspended for 3 months. We've talked about the effect of people on this when you have to cancel the surgery. It's just awful. 181 deaths yesterday. So deaths are increasing, as we said. And this is going to carry on rising until we get the benefit of the effect of the lockdown. 6,000 people being treated in hospital. Now, my Prime Minister, Boris Johnson, Secretary of Health, Matt Hancock, and the Chief Medical Officer, Chris Whitty. Well, Boris has definitely been confirmed as being positive. I'm pretty sure Matt has as well. And Chris Whitty is self-isolating. So, you know, it's. I'm not criticising my leaders any more than anyone else, but I remember there was a question in Parliament a few weeks ago, and someone was standing up, and they were saying something like, I don't want to get them wrong, but they're saying something like, "We believe in the democracy of this House. Can you give assurances that you will rule out the cancellation of Parliament?" As if it was a human decision. You know, we're up against the rules of biology here. We can't say, well, you know, this virus is a bit inconsistent with my way of life. I'm not going to accept that. No, I'm afraid biology dictates to us, and we have to follow its dictates. The idea that you can change things because you don't like them is ridiculous. So that we have to fight the biology of this virus at the moment. That's what we absolutely have to do. Now, another example, the 11th of March, the budget in my country, the House of Parliament was absolutely crammed full. People cheek by jowl, absolutely next door to each other, you know, crammed together. And I've been warning about this for weeks before. It's not as if this wasn't known. And it's not, I'm not just picking out the UK Parliament. It's everywhere around the world. Politicians just haven't got it. They've been too late. People are paying with their lives because of the political delays everywhere. Thousands of patients expected over the next few weeks. Drive-through testing for virus testing for key workers, which is encouraging. We are stepping up the testing now, but it cannot come quick enough. Now, the United States is another epicenter, I'm afraid. Cases greatly increasing. This is going to carry on increasing, especially as more testing is done, but it's going to carry on. Now, the BBC, and this is really upsetting. The BBC reported this morning that people in Queens, in New York, suburb of New York, died in the emergency department while waiting for a bed. This is just, you know, we're talking about one of the world's great cities here, and already this tells me that the health facilities are simply not coping at the moment, and we know it's going to get worse. Doubled in the last 3 days. Cases doubled in the last 3 days. New York and New York State a bit of an epicenter, but Louisiana not too far behind, unfortunately. Increasing deaths in the US. Now, the president has implemented the Defence Productions Act, which means he can order companies to produce whatever he wants. So General Motors are going to produce 100,000 ventilators in the next 10 days. And I'm sure in the next 10 days after that, they could probably produce 500,000. It's just that might be a little bit late. That's the only problem. And it's not just ventilators. This idea that it's just ventilators, you know, a ventilator needs an intensive care nurse to work it. It needs the anaesthetists and the intensivists and the physicians. It needs all the syringe drivers. It needs the oxygen supply. You need a whole range of drugs. All this has to go with it. It's not just the ventilators, it's everything that goes with it. So New York, quite a bit of an epicenter there. Good to see some leadership seems to be coming from Andrew Cuomo, Governor of New York, which is encouraging. Let's hope he can sort things out. Still a massive need for national coordination, of course, in the States. Quite distressing to see refrigerated trucks parked outside hospitals. The 3 weeks, it's estimated that the States are 3 weeks from the peak. So this means that cases and deaths could well be increasing in the United States over the next 3 weeks. Military ships, Comfort ship has gone to New York to deal with trauma cases because, of course, all the other medicine doesn't go away. Another reason not to have accidents. We need to minimise the effect on our medical facilities at the moment because everything else is still there. All the other needs are still there. Now, these are huge, I think, 1,000-bed military ships they have in the United States. As far as I know, in this country, I don't know if we've got any. Now, Italy. Yeah. Italy, cases, increasing number of deaths. Yeah, quite appalling situation in Italy, which we've looked at before. Sports and exercise forbidden, even alone, so you can't even go out for a run or a jog now in Italy. Only in your property. This is an email I've got yesterday. If you walk with your dog, you have to stay within a range of 200 metres from your home. So, again, these draconian lockdown measures, I am comfortable to predict will work. I believe they will work, but they are still working through. And the more testing that the Italian authorities can get going as well, the better it's going to be. Now, I think at this point we'll go on to a report from Australia.
Hi John, just coming to you from Melbourne, Victoria in Australia, letting you know that there's been very strict rules put in place today. Every day is changing. Our Premier Daniel Andrews, State Premier, has put his foot down today. He's been really cross that a lot of people have been going to beaches, socialising. It is beautiful weather, but everyone, so many people are not practising their distancing, so they've closed the beaches, told people to stay home unless they really need to go out, unless you need to shop, go to work, get medical supplies, go to pharmacies, or care for loved ones that are unwell. But also tonight, it's only a couple of hours away, 11:59 p.m. Anyone that travels to Melbourne internationally is going to be escorted via bus straight to hotels. They've got 2,800 rooms or something like that, and capacity to do more, to put people up for quarantine for 14 days. Similarly, people coming across the border, they would be made to also self-isolate for 14 days. Victoria Police have been given the go-ahead to fine individuals, which is over $1,000 fine if they're found to not be complying, and similarly businesses that remain open that should not be open, they can be fined. It's over $9,000, I believe. So people have been ringing up a hotline or something if there's gatherings or youths having parties or whatever else. But supermarkets remain open, and petrol stations and pharmacies at the moment. And anyone that, they said that anyone else that has work, that needs to go to work, needs to go to work and come home. As a nurse, for the last few weeks I've been practicing it already. When I go to leave work, I get out of my scrubs, I get changed, I'm doing all the hand washing. I went to buy another set of scrubs tonight and the company is out of them, so a lot of Victorian nurses are buying up scrubs so that they're doing the right thing, and laundering as we go. Yeah, as far as that, there's two or three cruise ships that I could see today when I went into town, went over the Westgate Bridge. They are not, the people are not allowed to get off. They're just refueling, getting food and supplies, and they are being told to go. Our spike in numbers yesterday was 111. Yeah, that was the biggest spike we'd had to date, but we are doing an extraordinary amount of testing as well. So to find that people are positive, mostly they're international travellers that have come across or gotten off a cruise ship and came across to Victoria. So the cruise ships that let people off in Sydney, quite a few people were positive, and yeah, this is why they're not allowed off the ships here. So I just implore everybody, please keep up with the social distancing, hand washing, looking out for others, and try to keep that number down for us nurses and doctors and allied health. We really need to nip this in the bud.
Well, thank you, Carol, in Australia for that. A fellow nurse in Australia who's been keeping me informed about the situation there. Now, let's just carry on with a few other countries today. Do take notice of what Carolyn said there. Social distancing is probably going to be the key here from everyone who's not in your household. France, again, very badly affected. Lockdown strictly enforced now in France, extended up to mid-April. I have heard a few distressing reports from France that in some suburbs around Paris, the lockdown is not being obeyed, where the police have difficulty enforcing things. So I would appeal to everyone in France to obey the lockdown. Our health depends on everyone else. Now, hope to get more information from Iran today. Plan to interview with an Iranian doctor later today. But increasing cases, 3,000 critical patients. And this was really quite upsetting. The one of the ministers of health in Iran has said that they now believe the virus might have been spreading since the 21st of January. That means there's a lot of cases in Iran, and we're going to see a lot more cases with a massive increase in numbers in Iran, if that is anywhere near true, because it means the community spread will have been there already. Japan doesn't seem to have too many new cases, but they are increasing in Japan. Not quite sure what's going on in Japan. Now, I'm very concerned for Africa. Kenya, they've got some restrictions, but fairly limited restrictions in Kenya. Curfew between 7 p.m. and 5 a.m. in Kenya. Right, South Africa. Now, emails from South Africa. South Africa went back into its lockdown today for 21 days. Unfortunately, it looks like every other day. So it looks like a normal day in South Africa to this writer. And all its provinces, it's very concerning. So this writer is saying it looks like any other day. There has been deaths. 2 relatively young women died, unfortunately, in South Africa. People are going about their business as usual. No social distancing. Thousands of people in queues at shops, standing indoors, close proximity to each other, etc. Streets and highways are busy as usual. People are walking in the streets. Children are playing out in the streets. They're saying it there. Okay, they're giving a reason for it. Doesn't matter what the reason for it is. Given that we believe there's some community spread in South Africa already, that means we've got guaranteed exponential increase in cases in South Africa unless this behaviour dramatically changes. Now, you could do a PhD on Sweden. I've had so many emails from Sweden. We did look at that bus at the start. Some people are saying they're doing quite well. Other people are saying they're not doing too well. They're certainly not locking down like other countries in Europe. So I won't read through that now. You can freeze frame that and read that email if you want. But any country that is not implementing the essential social distancing measures, in my view, will pay a high price for that lack of proactivity.